I'm Mark Geary, Head of Communications for Beaumont Health, and I'm joining you today from Southfield.
And I'm Carrie Manders from the Communications Department at Spectrum Health, joining you from Grand Rapids. We are here today to talk about the news shared this morning that Spectrum Health and Beaumont Health are moving forward to create a new health system on February 1st, 2022.
We'll start this news conference with opening remarks from Julie Freem, the current board chair of Beaumont Health and the incoming chair of the BHSH System Board. After that, she'll be followed up by Tina Fries-Decker, who is the president of Spectrum Health and the incoming president and CEO of BHSH System.
And after those opening remarks, we will open up to
recording in progress.
You are welcome to record this news conference, and we will call on reporters individually to ask your questions live. We will take as many questions as time allows. With that, I will turn it over to Julie Freem.
Thanks, Carrie. On behalf of Tina and myself, our board, and our leadership teams, I would like to express gratitude to our more than 64,000 team members. The fourth COVID surge we are experiencing has put an enormous strain on our healthcare teams, and I am so proud of how our physicians, nurses, caregivers, and staff have persevered. Our patients are truly fortunate to have such compassionate and dedicated caregivers. Today is a great day for Beaumont Health and Spectrum Health as we work to create a health system that is for Michigan, by Michigan. I'm proud to share the boards of Beaumont Health and Spectrum Health met late last week, and each unanimously reaffirmed their desire to join our two organizations together. Today, we are excited to announce that we are officially bringing our two organizations together and launching our new health system on February 1st. Our combined organization, temporarily known as BHSH System, will be led by an equal number of board members from Beaumont and Spectrum. I am honored and humbled to serve as the first chair of the new board. Now more than ever, our communities rely on physicians, nurses, and other caregivers for essential and life-saving care. As we know, healthcare is personal and local. The ability to make decisions at the local level is crucial. We look forward to partnering with our patients, team members, and health plan members as we build a new organization designed to improve the health of the communities we serve. As we move forward as one new health system, we will have greater ability to invest in the future of Michigan's health. And now I am thrilled to introduce Tina Fries-Decker. I am confident Tina is the right leader to bring our two health systems together and to lead us forward with a new health system that is for Michigan, by Michigan.
Thank you, Julie, for your thoughtful words. And I am honored and humbled as well to serve as BHSH Systems President and CEO. I look forward to partnering with you and our BHSH System Board to improve health in our communities, as well as collaborating with our four divisions that make up our system. First and foremost, I want to recognize our team members who are caring for all of us and who are the heart of our organizations. This latest experience with Delta's steady climb and then adding Omicron on top of an already exhausted system has been overwhelming and at times heartbreaking. Our team members' never-ending compassion, grit, courage, and integrity every day, even in the midst of so much trauma and burnout, demonstrates our determined commitment to providing outstanding care and coverage to all the communities we serve. I am incredibly grateful to each and every one of our team members, physicians, providers, and nurses. Their compassion, expertise, and dedication have saved many lives during this pandemic. We see you, we appreciate you, and we thank you. Today, our purpose has never been more critical and more important. What we've been through with this pandemic makes our purpose that much more clear and compelling. As health professionals, we are here to serve our communities. The pandemic also makes it clear that we must not be satisfied with the status quo. It's time to be bold, to transform health, to be even better. With the launch of our new health system, our aim is to provide greater value through exceptional care and coverage that is accessible, affordable, and equitable. We are well positioned to transform health in our communities. We have learned so much from this pandemic, and the complementary strengths of Beaumont Health and Spectrum Health will propel us forward with innovation, creativity, humility, and courage to make an impact for the people we serve. We have a bold goal, and we are thrilled to unite our two great organizations for Michigan, by Michigan, to improve the health of all of our communities. I am energized about the enormous and attainable possibilities that will allow us to thrive as we take this next giant step. And I look forward to our bright future together.
Thank you, Tina, and thank you, Julie, for those opening remarks. Now we will open up questions to the media. We will take questions until 1:30. So Mark, I'll turn it over to you to call on some folks to ask the first question.
Sure. So if anybody would like to raise their hand and ask a question, we can go from there. JC, you're the winner. First question. JC,
yeah, I was hoping.
Free Press.
Hey, thanks for taking my question. I was hoping you could explain whether or not the merger has got all of its approvals.
Yes.
Yeah, go ahead.
Both organizations have provided the applicable regulatory agencies with all requested information, and we are now able to proceed to launch our new health system.
Mm-hmm.
I mean, is there? I'm still a little bit confused. Is a merger been okayed at this point, or is there still some question marks out there where the merger might not be approved?
We've provided the Federal Trade Commission and state officials with all the information they've requested. The FTC statutory review period has expired, and we're confident that our new health system is pro-competitive and will benefit the communities that we serve.
Okay. Next question. Who has a question?
And report, if you would like to put your questions in the chat too, we can call on you that way as well.
With their hands. Any other questions from anyone? Oh, here's a question.
Yeah, Steve, why don't we go to you to ask your question? Steve from Michigan Radio, do you want to ask your question?
Certainly. Sorry about that. Are there any plans for consolidations? Are you looking at reducing the number of facilities that you currently have to improve the financial viability of the company going forward?
Thank you for the question. Our focus is on making sure that we're serving our communities, and where we don't have any overlapping services, we don't have plans for consolidation or limiting the services that we offer today. In fact, we want to make sure that we're providing exceptional services so that we can help people improve their health in every market that we're in.
Thank you for that, Steve. It looks like we've got a couple hand raised. We could go to Kristen.
Thanks for
Kristen
taking my question.
Yeah.
Thanks for taking my question. I'm curious about what happens to John Fox from Beaumont and what the deal was for him in terms of pay as part of the exit.
Thank you for your question. As announced in June, John Fox will be leaving the organization shortly. He announced his retirement at that time. And as with many executives in leadership positions in our industry and others, he does have a contract, and we will honor the terms of the contract. The independent consulting service that we use to review contract terms has looked at it, and it is market-based, and we will be moving forward with that as he leaves the organization.
Thank you. Can you disclose the terms of that contract?
No, we do not disclose the specific terms.
Okay, Karen Buffard from the Detroit News.
Yes, so as I understand it, then the FTC was had a certain length of time in which to raise objections to the merger. Is that correct? And if so, what was the date that they, the last date that they had within their framework to raise any objections? In other words, what was the date when you, felt confident that this was not going to have any issues with the FTC going forward?
So since last summer, we've been working with the Federal Trade Commission and state officials, providing them with the information that they've requested. We've worked through all that process with the various dates that they have, and those dates have now expired, and so we're confident about moving forward with our health system, ensuring that it's pro-competitive.
What were those dates, please?
Those dates varied by the process, and we have, again, those dates have happened and we've been able to move forward. We've also, like Julie said at the beginning, followed a process where our governing boards were able to review the materials and approve those, as we've are now announcing today.
Oh, okay. And when, so I guess two questions. When was the last and final hurdle with the FTC, the final approval? When did that come through? And when did the board approve its, the things it needed to approve? I'm just looking for a time frame here.
Right.
When was
So
all of this finalized, please? Thank you, by date.
The board finalized, the Beaumont board and the Spectrum Health boards each voted to reaffirm our position to join the organizations together last week. So that just occurred last week.
Okay, and the FTC final approvals or final date?
FTC disclosures are confidential, and so we cannot disclose the specific information as part of the Hart-Scott-Rodino Act. So I just want to make sure that we honor that and that it's understood by all.
Okay, so you're saying that you can't tell us the dates?
Correct. Not at this time.
Okay, thanks, Karen.
Thank you.
Let's go to, I think there's a question in the chat from, from Fierce Healthcare. You want to go ahead and ask your question? About top line statistics.
It looks like they said they have no mic at the end. If you go to For Michigan by Michigan website, there is actually a really nice graphic on there that has all that information.
All right, then let's go to Mark Sanchez from MIBiz for your question, please.
Thank you, Carrie. Good afternoon, everybody. I'm curious, as you went through your due diligence over the last 6 months, were you able to identify any type of cost savings, efficiencies? Quite often in corporate mergers, we see that as a selling point of the merger. Did you identify anything that you can operate a little more efficiently financially together? And if so, can you share that and how much?
When we first started the discussion, we identified a few synergies of what we could be able to do together and how this would help us benefit our communities. And as we've gone through the FTC process, we've held off on doing some of that information, and we plan to do more of that once we are now able to be integrated. So more to come, Mark.
Okay, and a follow-up question. As you went through the process, the Hart-Rodino review with the FTC, was there anything the FTC raised that they wanted to talk about? Maybe it wasn't something where they could file an objection or challenge, but was there anything the FTC questioned or raised that maybe caused you to pivot or alter your merger plan a little bit?
No, the FTC process was very similar to what was expected and with the guidelines that we are aware of from the FTC.
Thank you.
All right, thank you, Mark. I think we've got a couple of reporters with their hands up. Do we want to go to Juliana Knott from the Herald Palladium?
Thank you. I had two quick questions. First, what is the integrated systems compliance with the OSHA mandate upheld by the Supreme Court recently?
The CMS requirement
Yes.
for vaccine.
Mhm.
Both organizations had previously required the vaccine prior to CMS coming out with their guidance. And so both organizations implemented that in late fall, or early to late fall. And we're very proud that our team members have been, taken that, the safety of our patients, the safety of each other, and have been vaccinated, or there are people with religious exemptions.
And then second question, there's a nationwide nurse shortage. I was wondering if this merger allows you guys to be more competitive in attracting new professionals.
We are very focused on ensuring that we can, recruit and retain talented individuals for our organization. We're proud of what we've done previously, and we hope that people will want to join our organization to provide exceptional care and coverage within BHSH system. So we continue to try to make sure our culture is inclusive, is innovative, and is compassionate.
All right, JC, do you have another question, or is your hand
Yeah, I
still
have a
up?
real quick follow-up. I apologize if this was mentioned before, I might have missed it. It's kind of a two-parter. One, do you anticipate any layoffs as a result of this merger occurring? And two, I wanted to ask if there's any plans, to use this new system's, larger size to get better reimbursements from health insurers.
So right now we are in a healthcare worker shortage. And so we are doing everything we can to recruit and retain our talented team members here. So I expect we'll continue to do that because we want to make sure we can serve our community with the best people possible. And your second question, can you remind me of that again?
Yeah, if you plan to use the new larger size of the health system to get better reimbursement from insurers.
So our focus is to make sure that we provide accessible, affordable, equitable, and exceptional health care and coverage. And our effort is how can we create greater value for the patients and for the health plan members. We also have a health plan, Priority Health, where we want to make sure that that's still competitive in the marketplace with employers and individuals as they seek healthcare insurance.
Karen, did you have another question?
Yes, I did actually. Two questions. One is very similar to what JC was asking. I'm just wondering if you plan to raise prices on services now that you have a stronger market share. And then my second question had to do with union contracts and whether those will still be in force under the new merged entity.
So our focus for healthcare is to be affordable. We also need to make sure we're competitive, and that's how we look at our pricing. We are also very focused on transparency and ensuring that information is on our website. The union contracts still exist with the organizations, and those stay within those organizations as we become one system.
Thank you.
Kristen, Seamus, follow up as well?
Yes, thank you. I wondered if you could tell us more about Priority Health. Will Beaumont employees be transferred over to Priority Health? Is there employer-based benefit plan?
Priority Health is a not-for-profit health insurance company. We serve about 1.2 million members throughout our state, and we are often regarded as a very high-quality organization that offers products, Medicare, Medicaid, commercial, and individual. Offering the Priority Health insurance for all of BHSH team members, including Beaumont Health, is an option, but we have not done that yet. and pricing it and working out what that means. But we hope that that will be able to go forward, but we need to work on those plans.
And Tina, did you want to talk about patients too? I know that that's an important topic that we wanted to get out there. What happens next for them?
Thank you. I believe it's really important that we understand that today, while we've joined together as a single health system, nothing changes about the way our patients receive their care. Patients will still have the same physician, the same place that they go to for their care, and they'll still be able to work with their same insurance companies. So all patients should be able to access care in the way that they currently do it today. And the same applies to our priority health members. The health insurance coverage remains the same.
Thank you.
All right, Mark Sanchez, it looks like you have a follow-up question.
Yeah, just talking about the insurance reimbursements again. If my middle-aged memory serves me right, I believe in the 1997 consent decree between Blodgett and Butterworth's merger, there was some language that Priority Health would not receive favorable treatment from the health system or favorable pricing. Is there anything like that in this merger agreement between you two?
Currently, both Priority Health has contracts with Spectrum Health and contracts with Beaumont Health, and those contracts remain.
But any type of provision in there that
There is,
prevents any preference to the priority?
but what our focus is on affordability and wanting to make sure that we are taking care of our health plan members and our patients that is accessible, equitable, affordable, and exceptional.
Okay, fair enough. Thank you.
Looks like another question in the chat.
It looks like he doesn't have a mic. So we want to talk about, alongside efficiencies, the original merger announcement mentioned increase in capital investments into infrastructure. Any updates on those plans, or is it still too early to talk about what's planned moving forward?
As we launch our new system on February 1st tomorrow, there's a lot to do. And so we'll be working on some integration plans and processes and identifying where we need to allocate capital and what we need to do in terms of growth or further investment in our communities will be determined in a thorough process as we go forward with this integration.
Thank you, Tina.
I guess Karen and Kristen, you guys are asking all the questions today.
Hello. Okay, so I'm just wondering if you have any plans to expand Priority Health, perhaps outside the state of Michigan.
Yeah, our focus right now is serving Michiganders, and we want to make sure that we can provide exceptional healthcare coverage to anyone that may want it, whether it's Medicare, Medicaid, group, commercial, or individual.
Hey, Kristen.
Thanks. I wondered if you could expand a little bit more on that patient experience going forward. Will there be a new patient portal? Will My Beaumont Health disappear? Will it be a new BHSH type portal system? And how soon could people start seeing those changes?
Your portal will remain the same, whether you're at Spectrum Health or at Beaumont Health. Both systems use Epic, but everything remains the same. Again, you're using your physician will remain the same. We'll be working on things to share in clinical expertise across our system so we can get the strengths from both organizations and provide that to our patients. But right now, how you access care, either physically or online, remains the same.
All right, are there any final questions as we round this up? Okay, with that, I'll turn it back over to you, Tina, for some closing remarks.
Thank you very much, Mark and Carrie. And thank you again for all of you for joining us today. Today is an historic day, the launch of our new beginning, as together we will drive to innovate and improve health for all we serve. We are excited to provide greater value through exceptional care and coverage that is accessible, affordable, and equitable. And we are thrilled to be joining together for Michigan, by Michigan, to transform health. Thank you for joining us.
And thanks for the media for joining our briefing. If you have additional questions, you can reach out to the media relations team. Have a great afternoon.
Thank you.